Welcome to the Journal Club for this week. This article, titled The Effect of Pre-Cooling the Anesthetic Agent in Comparison to Increasing the Dosage on the Success Rate of Inferior Alveolar Nerve Block Using Articaine in Mandibular First Molar with Symptomatic Irreversible Pulpitis. It's a double-blind, randomized, controlled clinical trial which was done by Iranian group and newly published in the JOE. Achieving a proper anesthesia enhanced the patient comfort and cooperation during the treatment, also influenced the procedure success. So failure of nerve block compromised the treatment quality. Therefore, dentists frequently turn to use other methods to enhance the anesthesia, like complementary anesthetic technique, increasing the anesthetic dosage, using anesthetic agent with higher penetration, or cooling the anesthetic agent, which increase the affinity to the receptors of the nerve membrane and accelerate the blocking nerve impulses, which increase the duration of the anesthesia. So the aim of this study was to investigate the effectiveness of the cold anesthetic injection using 4% articaine compared to increase the dosage on the success rate of inferior alveolar nerve block in mandibular first molar with symptomatic irreversible pulpitis. For their material and method, they had a 90 patients who aged between 18 and 40. All of them were medically fit with mandibular first molar that diagnosed with symptomatic irreversible pulpitis and experienced moderate to severe pain. They exclude patients who received any medication that interfere with anesthesia, such as antidepressant and beta blocker. Also, they exclude the patient with a neuropathic disorder, genetic and metabolic disorder, pregnant women, and inflammatory and autoimmune disorder. They use articaine 4% with 1 to 200,000 epinephrine in all study group. They divided the 90 patients randomly into 3 groups. The first group received 1 cartridge in a standard protocol of inferior alveolar nerve block. That was injected slowly during 30 to 60 seconds. The second group received 2 cartridge in the same process of the first group, but they had the second injection done after 5 minutes. For the third group, which is the cold cartridge group, also they had the similar process to the first and second group, but the 4% articaine was placed in a refrigerator and kept in a temperature between 4 Celsius to 6 Celsius. Also, they had a digital thermometer to ensure the temperature. And to prevent any temperature-related variability, they used the cartridge immediately upon retrieval from the storage. The anesthetic efficacy and the pain received of the patient was assessed using a VAS scale. So coming to the result, the pairwise comparison of the group using Benforini test revealed that the level of pain did not show a significant difference only between the second group and the cold group, but a significant difference was reported between the first group and the second group, also between the first group and the third group. Additionally, the pairwise comparison of the time point revealed that the level of pain shows significant difference between all time points, except between the time of the injection and the time of access cavity. There was no significant difference. So to conclude, both the cold anesthetic injection and increasing the dosage of the anesthesia can improve the success rate of inferior alveolar nerve block in mandibular first molar with symptomatic irreversible pulpitis. However, increasing the dosage appears to provide more constant and reliable improvement in pain reduction with a multiple stages of the procedure. And thank you.